Hello everyone, my name is Akanksha Mela, and today I will be presenting a case of recreational nitrous oxide use with pulmonary emboli. Now, nitrous oxide was first discovered by Joseph Priestley in 1972 and was used primarily for public entertainment in its early days. Over the years, it's been recognized for its anesthetic effects used by anesthesiologists as well as dentists worldwide. More recently, however, the use of nitrous oxide has become more widespread in the form of laughing gas parties. And so today I will outline the case of a 26-year-old female with a history of morbid obesity, PCOS, and depression who presented with a subsegmental pulmonary embolism in the setting of nitrous oxide abuse. The patient had been ordering tanks of nitrous oxide on the internet and huffing up to 2 liters weekly over the course of 1 year. She presented to our institution with auditory and visual hallucinations after leaving against medical advice from a neighboring institution a couple hours earlier. Her labs were notable for macrocytosis, elevated homocysteine levels, as well as B12 deficiency. During the hospital course, her mentation improved and she was anticoagulated and subsequently discharged on apixaban, vitamin B12, as well as folic acid supplementation. Now, interestingly, a year earlier, prior to this presentation in May of 2020, she had been diagnosed with bilateral large pulmonary emboli with large clot burden as well as right heart strain. At that time, a DVT in the right lower extremity was also noted. At the time of that diagnosis, she had been inhaling nitrous oxide every day for 2 months prior to the admission. She had completed 6 months of treatment with Coumadin prior to her presentation to our institution a year later. Now, although research in the realm of nitrous oxide abuse and venous thromboembolism is limited, animal models as well as previous case reports have linked chronic nitrous oxide inhalant abuse with B12 deficiency, elevated homocysteine levels, as well as thromboembolic events. The mechanism by which this happens is by nitrous oxide decreasing levels of active vitamin B12 when used chronically. This phenomena is widely used to create animal models with vitamin B12 deficiency. The inactivation of vitamin B12 is known to inhibit methionine synthase, which plays a key role in the metabolism of methionine as well as folate. This inhibited process subsequently results in hyperhomocysteinemia, impaired endothelial cell function, and a hypercoagulable state. And so in this case, the patient had been abusing nitrous oxide for a year. In this patient with no evidence of thrombophilia, pulmonary embolism, and DVT were diagnosed successively with the presence of elevated homocysteine levels. Considering her medical history, we suggest that nitrous oxide abuse may play a key link in pulmonary embolism, even though other risk factors for venous thrombotic events were present, such as the lack of exercise as well as obesity in her case. In conclusion, we postulate that chronic inhalation of nitrous oxide likely is associated with an increased risk of thromboembolic events through elevated homocysteine levels. As the realm of recreational drug use expands and access to substances of abuse becomes easier, it's important to keep nitrous oxide in mind, given the possible correlation with thromboembolic phenomena. Thank you.